I'm surprised that the late hour, lunch is ready and so many people are still waiting. I'm very happy also. So our story is about the typical story of a post-MI patient with left ventricular dysfunction and how do you manage them, because once you have done an angioplasty and then a patient is discharged, you have to advise them. So you have to assess the patient, LV, RV function, you have to look for their socio-economical status, comorbid condition, their social history also, the sleep pattern, physical activity pattern, all this needed to be done. But there are many key areas which we have to pay special attention to. I have divided them into 5 areas: diet and weight management, physical activity, the mind and stress, salt, sugar, alcohol and smoking, and finally sleep. And this is a typical patient who is given a diet chart. The MI did not broke his heart, but the diet sheet we give them always breaks their heart. He said, what is the point in living? No salt, no sugar, no fat, no protein. Over a period of years, we have overemphasized the no fat, no sugar, no salt, all so much that patients with after acute myocardial infarction recovering, they recovered very well from their MI, but they are left with a very, very depressed situation. Do we really require that? Because the only secondary prevention trial, the Lyon Heart trial after acute myocardial infarction, looking at the diet pattern, their fat intake was 35%. And our Kerala studies, our average fat intake is 17%. So all the criteria, all the dietary advice we have been applying is related to the Western diet, where they are taking 30-40% of fat in their energy in the diet. Not our patient, they are taking 15 to 17%. Maybe things may have changed a little bit now, but the 2009 National Nutrition Board study says Kerala diet fat percentage is 17%. So instead of concentrating on the don'ts, we have been concentrating on the don'ts. I feel we should concentrate on the do's. Because we have been saying no fat, no fried food, nothing, no coconut oil, no coconut milk, everything, and make the diet bland. But instead, there are seven food items proven without any doubt which are going to be beneficial. Tell them to take that ad libitum. The fruits, 4 to 5 servings a day. Vegetables, different colors, 4 to 5 servings a day. Pulses and legumes, at least once a day. And then fish if is a non-vegetarian. And nuts, seeds and oils. People used to discourage people eating nuts because the fat content is low. Yes, it contains monounsaturated fatty acid, but shown to be beneficial to the heart. And whole grain, already we had the quiz also, the whole grain, the fiber. And lastly, only 2 oils have been found to be beneficial for heart: olive oil and canola. Both are available, and canola is cost only as much as coconut oil now, and it's available everywhere. Eggs, it elevates 1 egg, increase the LDL cholesterol by 4 milligram. But you are giving a drug which reduces the LDL cholesterol by 60 milligram. So why bother about why take away the pleasure of egg? And secondly, we are all protein deficient. You require 0.8 gram per kilogram body weight of protein, and our diet is providing only 50% of protein requirement to most of us. So, and egg is the cheapest one. So why? Even red meat, it elevates LDL, yes. But we are not Caucasians. They eat daily red meat. We eat only once in a week. Why discourage our patients post-MI? Why discourage them eating once in a while 85 gram of beef or mutton? Grated coconut, again, it contains a lot of fiber. It contains a little bit coconut oil, and coconut oil we don't know, controversial, neutral maybe. one study, we had only one study on coconut oil in Amrita, secondary prevention after MI, coconut oil versus sunflower oil, and no difference in the LDL cholesterol because most of these patients are already on statin. So it doesn't matter which oil they use because they are already on statin. And in secondary prevention, maybe oil doesn't matter. However, if they can afford, recommend canola or olive oil. And our people are vegetarians or omega-3 deficient. And if they are not taking fish naturally, they have to substitute with either soya bean, flaxseed, fenugreek, mustard. All this contain the only vegetarian source of omega-3. So the dietary recommendation I just to weight management, we all know it is important. The standard, different methods are there, but I recommend a modified Mediterranean low-calorie diet. I don't want to go into detail. Physical activity is important. The physical activity has 4 components. One is the aerobic exercise, the other one is resistance exercise, third one is balance, and fourth is balance and mobility, and last is stretching. So we generally advise only aerobic exercise. You walk 30 minutes. But that is not enough. You have to advise them about resistance exercise at least 2 to 3 times a week. We have to give them training for mobility and balance. And the stretching exercise should be also a part of this. I think how to work it out, how to find the target heart rate, and what is the heart rate reserve, and all. Too late now. This is a simple method, the Borg perceived exertion, where you can generally assess what will be the severity of the exercise, and based upon that, you can give recommendations for exercise. Then balance exercise, there are 4 exercises available. Then also, lastly, the stress after MI. Several studies have shown that stress after a myocardial infarction is an important contributor, and most of the patients, 30% of patients after MI has depression. And secondly, loneliness. We generally, the bystander, the relatives will say, no talking, no relatives, no friends, nothing. And they are isolated and prevented from interacting. Instead, people who do well after MI are people who are allowed to get the same job they were doing before, people who are doing same activity they were doing before, and not the people who sit at home quietly and taking rest. They don't improve. So we have to release the stress of the patients. Sometimes we require counseling also. And other things are social deprivation index is coming up in a very big way because the loneliness is a big problem in the West and slowly creeping up to our community also. And it has been shown that the social connections and social relationship, going to the church, going to the club, going to the other activities, actually serves a purpose. It improves your health. So then I don't want to, the sex life after MI, you can actually, if it's uncomplicated MI, you can even start 1 week after an MI, but generally 2 to 6 weeks after MI, and you should know that the requirement, if you can successfully do the stage 2 or the bruise, you can have a sexual relationship. And the studies have shown that a person after an MI who returned to a normal sexual life, they live longer. So naturally we should positively encourage, and if you have a beta blocker, if the ejection fraction is normal, there is no harm in reducing the beta blocker if there is erectile dysfunction. And salt, sugar, smoking, and alcohol, we all know, I don't want to elaborate, but alcohol, the World Health Federation says no alcohol, any amount is harmful. But there are some studies, this alpha-omega study specifically after acute post-MI patients, they said that small amount of alcohol reduced the hazard ratio was 0.87, showing that there is a 10 to 13% reduction in the event rate if you take a small amount of alcohol. So current non-drinkers should not start alcohol. Patients who choose to drink moderate amount, or less than 15 gram per day or less than 100 gram per week. And binge drinking should be harmful. And sleep is important. You require 7 to 9 hours sleep every day. You should not ignore the sleep. And how to improve. And to summarize, a heart attack need not be an end of active life. It could be a new beginning, a wake-up call to care for diet, exercise, weight reduction, and relaxed lifestyle. Diet need not be restrictive, need to be imaginative. It can have normal, healthy sex life. Sleep well, and one can reap great benefits. And finally, take care of the risk factors, insist on regular follow-ups and medications. For many, an MI may turn out to be a blessing in disguise. Thank you.